it's a really great pleasure to be here and indeed to question everything. I think for many people the big issue, and I think it's perhaps the most important question, is whether lockdowns are right or moral, whether or not they're effective. But I'm an economist, and famously economists don't have any morals. We don't know the difference between right or wrong. So I'm going to focus on the question of whether lockdowns worked themselves. Now, I'm hoping there should be some slides on the screen, which would appear. That's great. Now, the place I'm going to start is just to think about the case for lockdowns. What needs to be true for lockdowns to be relevant or potentially an effective intervention? And I think there's 3 points that we need. The first one is that if we don't have restrictions, we're told that cases will continue rising, health services will be overwhelmed. And that's what we heard back in March, in October for the second lockdown in England, and then in December, January for our third lockdown. And this is quite right in the sense that these are very, very big and serious interventions to take away basic freedoms, sort of things we shouldn't be doing unless it's absolutely essential. There's no other alternative. But of course, we also need lockdowns to be effective. We may think there's nothing else we can do, but if lockdowns themselves don't work, well, then again, they're not worth doing. But thirdly, and I think something the government hasn't paid enough attention to, lockdowns may be effective, but are they effective enough to outweigh the costs of restrictions? And by costs, I don't just mean economic costs, but deaths that may be caused by lockdowns, other health effects, psychological, social effects, and so on. And we perhaps just start with that third point to give an illustration, because there have been some efforts and some research to look at the sort of cost-benefit analysis, and we can talk about whether that's an appropriate thing to do, but it's something we do look at for every government intervention. And there's a few papers on this. Suffice to say, it's not an easy job to work out the potential costs, the potential benefits of lockdowns. But Professor David Miles, funnily enough, from Imperial College, just as the famous Ferguson Imperial modelling comes from, back in 2020 did a cost-benefit analysis of the first lockdown. And their estimates, they looked at different ranges of what costs might be, and suggested on using standard health assessments and valuations, if lockdown 1 had averted over 400,000 deaths, probably wouldn't be quite enough to outweigh the lowest estimate of costs. Okay, so if you may remember, Ferguson from Imperial suggested 500,000 deaths if there are no interventions. The first wave saw about 50,000. So in other words, if Ferguson had been right, without the lockdown, we'd have seen 500,000 deaths. Possibly we're getting into territory where the lockdown may have met that cost-benefit test. I think the point is we need to have a very big effect for lockdowns to be, to meet that cost-benefit test. Okay? So let's deal with that first question. Are they essential to stop a big surge in cases? Well, we've already seen some evidence from Claire about the pattern of infections, and this idea that infections will inexorably rise to unsustainable levels doesn't seem to hold up. We seem to have these waves of infections which peak. We have an increasing rate which then slows down. We get to a peak and then decreases. And this seems to happen irrespective of interventions. We see this across the world. So there's a paper by Aitchison, Levitt has showed this as well, that you get a very similar pattern of waves of infections irrespective of interventions. So in other words, infections do decrease in a wave, even if you don't have interventions. That doesn't necessarily mean that will always happen before health services are overwhelmed. But if you look, for example, in England, Simon Wood has found in an excellent article with very sound statistics that infections were decreasing before all of the UK, of the English lockdowns, all 3 of the lockdowns, infections were decreasing already. Now, no, that doesn't necessarily mean that lockdowns had no consequent effect. But in terms of that first question, were they necessary to stop infections decreasing? The answer is no. And this is just we've got lots of indicators for England. This is one from January, looking at the famous ZOE estimates, suggesting that across all regions, actually, this is for England, but infections had clearly started to decrease fairly rapidly before the lockdown happened. Of course, many areas were in different stages of restrictions, but even in those regions like Yorkshire that weren't in the highest level of restrictions, infections were already going down. Okay, but we know this from many, many cases. So England, France back in October, famously Sweden in April last year, again, December and April. So cases go up and down, but they can decrease without lockdowns happen. Florida famously back in September got rid of all their state level restrictions, and yet we saw infections go down after their winter rise without a lockdown. Japan has never had a formal lockdown. They've had some interventions, but have seen cases rise and fall, and the same in lots of other countries. But that doesn't necessarily mean that lockdowns don't have some effect. So we can be fairly sure that they're not necessary for infections to decrease, but do they have any effect at all? Well, there's various types of evidence on this, and we need to be careful and distinguish. And the big distinction is between the modelling studies. So there's a famous paper by Flaxman in Nature published last year suggesting that lockdowns worldwide averted 3 million deaths. But the way that these modelling studies tend to work, and I'm sort of generalising a little bit, you compare what actually happens to modelled or expected deaths. And then the difference is attributed to NPIs, these sort of lockdown or restrictions. The point being that any reduction in deaths relative to what you've modelled is down to lockdowns by assumption. So the big flaw with these is that they don't take account of other factors that may have led to reductions or lower deaths. And we'll talk about some of these in a little bit, but more generally, we can think about voluntary behaviour change that may have happened. So the point with these modelling studies is that they may be useful for looking at patterns of infections, but they tell us very little about the real world data about whether lockdowns actually worked or not. So the other type of studies which I think are more important for this are these real world data studies, empirical or econometric studies, which look at the data before and after lockdowns, ideally in countries and areas where lockdowns or restrictions have happened at different times. So then you can compare the effects relative to non-lockdown areas. Okay, and these are much more likely to give you a real taste of whether lockdowns are effective. But there are problems with these studies as well. Two I'll highlight in particular. Lockdowns may very well be imposed when rates are already high. So we see that infections are going up. The government imposes a lockdown. Well, if infections carry on going up, because they were anyway, you might observe a spurious positive correlation. It looks like you've had a lockdown and cases go up. So you've got to be a bit careful of avoiding that. At the same time, when infection rates are high, there certainly is pressure to introduce lockdowns. But what may happen as we've seen, you have this pattern of behaviour and infection rates go down anyway, you may find that as infection rates go up, voluntary behaviour changes, people take less risks, and infection rates start to go down, just as, or maybe soon after, lockdowns were imposed, but it wasn't directly due to the lockdowns. So in this case, you might have a spurious negative correlation. And we can think of this simply, when you look at countries in Scandinavia which have had lots of attention, like Sweden and Finland, both of those countries had very light or no lockdowns at all. Finland had much lower rates of infection than Sweden, and arguably had, therefore, much less pressure to impose a lockdown. So the fact that Finland had low lockdowns, not many deaths, doesn't mean that was because they had no lockdown. Sweden's an interesting case because they had a very, very high rate of infections a bit before lockdowns were even considered, way back in February, but then chose not to go down the lockdown route. So it's more like a nice exogenous experiment, if you like. So we've got to be careful of both these dangers. And there are studies which really take account of these. So we've got to, rather than going through individual studies, we can look at some of the literature reviews, like Doug Allen from Canadian economist, to look to the whole series of COVID-19 studies. The overall conclusion, once you take account of this sort of voluntary behaviour change, lockdowns have had, at best, a marginal effect on the number of COVID-19 deaths. Okay, so he doesn't conclude there's no effect at all, but a marginal effect at best. And here's one example, one of the best empirical studies, Bendavid 2021, similarly concludes, while small benefits cannot be excluded, we do not find significant benefits on case growth of lockdowns, or the more restrictive non-pharmaceutical interventions. So this is fairly typical of the studies that do control for these sort of, they look at what was happening already to trends in countries before lockdowns happened. It's, quite, for me, a very striking conclusion, because people just assume lockdowns are strongly effective. And actually, we can't rule out that they have no effect at all, even on short-run case growth or hospitalisations or deaths. We can't rule out that there's some small impact. And we can similarly look, that's the correct academic evidence, and we've got to be careful when we look at country-state comparisons. It's easy to cherry-pick. You can select countries that make your case, but really to illustrate the findings of the academic evidence. So here's one graph looking at 5 countries over the winter. So UK, we know we had rolling lockdowns, restrictions. Spain had restrictions but didn't have a winter lockdown. Sweden, we know, never had a lockdown. They did introduce some restrictions. The USA, big variation across states. And then the Czech Republic, they had a very early and strict lockdown. And then back in October, they reintroduced their lockdown and basically kept it going all the way through until March or even April. When you look at the graph of what happened, what strikes me is nothing. If you were to look at this without the country names on it, it would be very hard to work out, what was going on. Is it clear, for example, that Sweden had a different pattern of cases than other countries? And of course, every country has different levels of measurement and different reasons why they may have different cases. But looking at the trends, I think, is the most important. And I think the main thing that strikes me here is the Czech Republic. Despite their long lockdown in October, they saw cases rise again during that lockdown, then go down. They kept their lockdown going, and then cases started going up again. And Czech Republic has ended up having the highest mortality rate, or one of the highest mortality rates in the world. So even during that lockdown, we saw those cases go up. Here's another example. We've heard lots about the states. So here's two states, classic ones in America. We got Florida, we got California. Florida back in September last year decided to have no state restrictions. If you looked at this graph and you didn't know which was which, would you be able to tell which was a state that had nightclubs open with no restrictions, that had no mask mandates, that had school mandates, schools open? All the things that people are terrified is going to happen from Monday, when the UK or when England gets back a little bit more of its freedoms. Actually, over that period, compared to California, another sort of sunny state, both states saw a big increase in cases, and hospitalisations and deaths. But the trends were not particularly different. If anything, Florida had a lower increase over the winter. And in fact, when California started reopening from about May 2021, that sort of time when it really the death rates fell below those of Florida. Doesn't mean that's why they fell below Florida, but this idea that there's a clear, measurable impact of lockdowns simply isn't there in the academic evidence or in the data. And this is really puzzling for many people. People can't get their heads around it sometimes. Why should this be the case? Surely, if lockdowns are stopping people interacting, we know that the disease is infectious, passes from people. Well, we've already heard it's a much more complicated story from Claire earlier on. I think that was really, really helpful. But we can just think through why people's sort of presuppositions may not be the case. And one of the obvious things is that actually voluntary behaviour change is more important than legal restrictions. People tend not to be monsters. People don't want to put other vulnerable people at risk. As infection rates go up, as death rates go up, people do change their behaviour. So if you think about, your group of people meeting in a pub, infection rates go up. There's lots of stories in the press about people in hospital and so on. And you're living with your granny, or you're a vulnerable person yourself. Are you going to still go to the pub and meet with your friends? Well, probably not. On the other hand, if you're a group of students who perhaps already had COVID or are at lower risk, and you're not really mixing with other people, are you willing to still go to the pub? Well, you're more likely for that to be the case. So the voluntary behaviour change can have a big impact on infections, potentially. But when you have a lockdown, what happens okay, you may have some marginal impact still on infections, on transmission, but really you're affecting the people who are less vulnerable and less likely to transmit anyway. So you can have a big economic impact because you shut down the whole pubs, but you have less of an impact on infections. And in fact, there's some good academic evidence on this. So there's another review of COVID studies by Herbie looking at mandated changes. The vast majority of changes in infections and so on comes from voluntary behaviour change rather than mandatory change. But worse than that, restrictions themselves can cause unintended behavioural impact. And we know this, from all sorts of government interventions. Classic example, we had September last year, we had the 10 p.m. curfew in England. Pubs had to shut at 10 p.m. because alcohol was associated with spread. So this is going to stop infections spreading. Well, what happened? Nottingham always gets it in the neck. I don't know why. This is a photo from Nottingham. Crowds flooding the street after the 10 p.m. curfew kicked in. If you can think, subject to Claire's caveat about how infections are spread, what happens at 10 o'clock curfew? The pubs kick out, the restaurants kick out. In London, everyone gets on at the tube at the same time. If that's a route for infection spread, can you think of anything worse for spreading infection than that? But of course, unintended consequences are much broader. You shut the pubs where you've got perhaps people infection control, people spaced out, you've got people using hand sanitizer and so on. Well, young people are not going to meet up perhaps for a couple of weeks to flatten the curve, but that's not going to happen for months on end. So what happens? You have house parties. You have people meeting up in the home where they may be less regulated. The idea that you can ban outdoor sports for months on end, and that doesn't have unintended consequences on the health and even potentially how badly people get COVID, is clearly a nonsense. There's other reasons why, we might actually, when you think it through, lockdowns will have a less of an effect than you might otherwise think. Claire's already talked about the spread in hospitals and care homes, which of course are going to be less affected by lockdowns. You don't stop health workers going to hospitals or care workers going to homes where spread can be really high, and then back into their own households where transmission tends to be much higher than in things like hospitality. And we've already heard about things like seasonality, immunity effects, which may be really important drivers of spread. So the point being that it shouldn't be so much of a surprise that lockdowns themselves have a low or small or even no independent impact on infections and particularly on deaths. Quick point on, we've already heard on what happens when restrictions ease. So I'll skip through this, where we've already heard about what happens in some of the states back in March when they eased restrictions, basically nothing. But some evidence on more specific restrictions. There's lots of attention on schools, lots of attention on masks, but the academic evidence is pretty similar. It's at best weak, it's mixed. You can find studies in both directions, but the overall weight of evidence is that these measures and others tend to have a small specific effect. Masks, of course, is getting all the attention of people at the moment. We can be pretty sure from looking at the data from the states when states have dropped mask mandates or imposed them, and from other countries, that even if masks have a small marginal effect, which they may not at all, there's some academic evidence that says they don't at all, they don't have an effect that is observable or measurable in the data. And the idea that people are spending so much time worrying about getting rid of mask mandates when this is the first thing, where the evidence is perhaps the weakest, is, to me, really disappointing, I think, because really, I think we have enough evidence from around the world to know that this isn't the driver. Mask mandates are not the thing that will control infections. Perhaps the most important slide of all. We've talked about the evidence on hospitalisations, on deaths, directly from COVID, and of course we've heard that really important evidence about the measurement and how difficult it is to measure and to be sure you're really measuring COVID deaths and so on. Quite right. One way around that is to look at the impact on excess mortality, and of course this can also help you get to grips with deaths that may be caused by lockdowns themselves, as well as by COVID itself. And there's a very interesting study that came out just a couple of weeks ago from the National Bureau of Economic Research in the States, looking at 43 countries, basically every country they could get decent data on, and every US state. They control for pre-existing trends, so they try and say, well, we understand that infections may have been going up before lockdowns were imposed. We control for that sort of thing. Their conclusion, I think, is not just striking; it's really mind-blowing. I think for the general public who have in their mind that lockdowns have been essential for saving lives. They find that, or rather they fail to find that shelter-in-place policies, lockdowns, saved lives. But not only that, they find a positive association between shelter-in-place policies and excess deaths. In other words, they find, if anything, when lockdowns are imposed, excess deaths increase. They also look at this country by country because lockdowns can mean very different things in different places. And so they look to whether these findings are homogeneous. Are they the same across countries? They find very little evidence for heterogeneity. The only thing they do find is that there's more favourable evidence for lockdowns in small island states, and nations, so like New Zealand and Hawaii. And of course, I think with those areas, it's very hard to separate out the effect of lockdowns, particularly with New Zealand, which imposed lockdowns very early on, but also with very, very strict border controls. Now, what the long-term gain with those sort of states are is another matter as well. But I think it's a very striking point. Not only did they not save lives, lockdowns may have led to excess deaths. So forget about all the other costs, economic, social of lockdowns. They may not have even saved any lives. So where are we overall? I think we can say the academic evidence, it's mixed, it's uncertain. There's lots more to know about it. The weight of evidence suggests that even short-run impacts of lockdowns is modest. When we talked about, to override the benefits, the costs of lockdowns, we need a really big effect. We can be pretty sure that isn't there. The evidence for many individual restrictions is weak and or conflicting, and I should say completely non-existent in many cases for the substantial meal rule, for curfews, for many measures relating to hospitality. But overall, the impact of lockdowns may be to actually increase deaths. Thank you.